Welcome to Humanautic, unlocking the secrets inside your body and brain. Have you ever wondered how doctors or nurses find your veins so easily, even when you can barely see it yourself? Or how that tiny plastic tube called a cannula manages to stay inside your vein without leaking blood everywhere? Today, we're diving into the science, technique, and precision behind one of the most common hospital procedures, inserting an IV cannula. Stay till the end, because once you understand how it's done, you'll never look at your arm the same way again. What is a cannula? A cannula is a small, flexible tube that's inserted into your vein to give you fluids, medications, or even draw blood. It's also called an IV line or intravenous catheter. It usually comes with a sharp metal needle inside. This helps pierce your skin and vein. Once the needle is in the right place, it's pulled out, and the soft plastic tube stays inside your vein. That's why it doesn't hurt much after the insertion. Only the needle goes in briefly. The cannula itself is flexible and safe to stay in. Understanding veins. To find a vein, we first need to understand what veins actually are. Veins are the blue lines you sometimes see under your skin. They carry blood back to your heart. Unlike arteries, veins have thinner walls and lower pressure, which makes them perfect for inserting a cannula. Doctors usually target veins that are close to the surface, straight for at least a few centimeters, and big enough to fit the cannula without collapsing. That's why most IV lines are placed on your hand, wrist, or arm. These areas have easy-to-access veins like the cephalic, basilar, or median cubital vein. Making the vein visible. Finding a vein isn't always easy, especially if someone is dehydrated, cold, or has small veins. That's where technique and tricks come in. Here's what professionals do. Apply a tourniquet, a tight band tied above your arm. This slows blood flow back to the heart, causing veins below it to fill with blood and pop up. Tap or rub the skin. Gentle tapping stimulates the vein to dilate. Use warmth. Heat expands blood vessels and makes veins more visible. Positioning the limb. Letting your arm hang down increases blood flow by gravity. Some hospitals even use infrared vein finders. These shine a special light that detects veins under your skin. Inserting the cannula. Once a good vein is found, it's time for the actual insertion. This requires a steady hand and careful coordination. Step 1. The area is cleaned with antiseptic, usually alcohol or chlorhexidine, to prevent infection. Step 2. The nurse or doctor holds the cannula at a low angle, about 15 to 30 degrees, and inserts it through the skin into the vein. Step 3. As soon as the needle tip enters the vein, you'll see a small flashback of blood in the cannula's chamber. That means it's in the right spot. Step 4. The needle is gently withdrawn while sliding the flexible plastic tube further inside the vein. Step 5. The cannula is secured with medical tape and connected to an IV line or cap. After insertion. After the cannula is in, nurses flush it with a small amount of saline to ensure it's not blocked. You might feel a cool sensation in your arm. That's normal. If the cannula is placed correctly, there should be no pain, no swelling, smooth flow of fluid. If it hurts or swells, it means the vein might have been irritated or the cannula slipped out. In that case, it's removed and replaced safely. Why skill matters. Inserting a cannula might look simple, but it actually takes a lot of training and experience. Medical professionals practice for months to learn how to find veins on different types of patients, from babies to elderly adults. Some people have hard to find veins, and that's where experience makes all the difference. The key is confidence, patience, and gentleness. So next time you're in a hospital and a nurse finds your vein in one try, remember, it's not luck. It's years of science, skill, and precision. That tiny tube in your arm carries life-saving medicine straight into your bloodstream. One of the simplest yet most important procedures in modern healthcare. If you found this video fascinating, don't forget to like, share, and subscribe.